called Finding the Sound. It's the story of a fairly young patient who was on dialysis who all of a sudden had a very large heart sound, a murmur that they have never heard before, a very loud systolic murmur. I'll show you the first image loops of this patient, and it will be your responsibility, or actually the question I'm going to have to you is, what is the reason for the systolic murmur? Okay? Parasternal long axis view, the left atrium, aortic valve. Okay? This is the color Doppler. This image quality was not so good from the parasternal position. This is here now the short axis view. Okay. This is the four-chamber view. Left atrium, right atrium. Here's the right ventricle. You can see the moderator band here. This is the septum with a very bright echo at the middle of the septum. This is the lateral wall here. Let's take a look at the thickness of the septum, just to give us a brief estimate. 15, which is not surprising. The patient has left ventricular hypertrophy simply because he also has hypertension. Okay? Hypertension caused by his renal problem. Now, anything else you see? Okay. Okay, this is now the color Doppler. Here we have a bit of mitral regurgitation. He's had mitral regurgitation all along. Also in his previous studies, we saw that MR was mild to moderate, and he certainly didn't get much more. So this was probably not the reason that, the reason for the systolic murmur. Of course, you want to take a look at the aortic valve. Okay. And now I'll show you the Doppler tracing across the aortic valve. Okay. So the patient has a maximal velocity of 3.4 meters, which is a gradient of 50 millimeters mercury. And if you take a look at the mean gradient, okay, this is the mean gradient. Okay, what we have is 29 or 30 millimeters mercury. Does he have aortic stenosis? Is this the cause of the systolic murmur? I'll show you some more images. Again, mitral regurgitation. There's also a bit of aortic regurgitation. Okay. Okay, so I'll ask you a question. I want you to answer and tell me if you think you know what the cause of the murmur actually is. Do you think it's the ventricular septal defect? Do you think it's an incidental murmur? Do you think it's an atrial septal defect? Or do you think there's some other form of congenital defect? And with other form of congenital defect, I also mean a congenital form of aortic stenosis. Okay, I'll give you some more images and some more explanation to this case. Well, what we have here is we have a patient who has very hyperdynamic left ventricular function. You can see that the left ventricle is really pumping extremely well. We calculate an ejection fraction in the range of way above 70%. Right ventricle function is also hyperdynamic. We have a bit of pericardial effusion, which is not unsurprising simply because the patient is also on dialysis, and patients with renal problems very often have some form of fluid accumulation in the pericardial sac. But what is really interesting in this patient is that you can see turbulent flow here within the entire ventricle. You also see turbulent flow here in the outflow tract, even though there is no obstruction. And if you take another look at the signal across the aortic valve, you can see that the velocity is elevated despite the fact that his aortic valve is morphologically completely normal. There was no sign of obstruction, there was no sign of sclerosis or anything else. So aortic stenosis is very unlikely. So the question is, why does he have elevated velocity across the aortic valve? It's simply not attributed to some form of subvalvular obstruction, because we do not see a SAM or any other problem here, and we don't see a membrane here. The problem that we have here is that the patient is simply very, very hyperdynamic, and we have a very high flow velocity across the valves. And if we have velocities which exceed something in the range of 1.8 to 1.9 meters per second, we start to hear the sound. And in this case, we have velocities which are far above 3 meters. Looking at the LVOT signal of this patient, you can also appreciate that he had a very high LVOT velocity, simply also caused by the high velocity of the blood flow in this patient. The reason why he had such a high velocity was because he had a dialysis shunt with a high shunt volume, which causes the left ventricle to have excessive pumping function and therefore more volume pumped through the valves. So again, this is another very interesting case, which just shows you that you have to understand the hemodynamics to really understand also clinical findings such as a systolic murmur. I want to just share you the results of the poll that we made. Here you can again see that most of you thought it was a ventricle septal defect. Simply, this is not true, because the patient never had a ventricle septal defect, and a systolic murmur appeared after we saw him last on the echocardiogram. So a congenital ventricle septal defect is nothing that would have been there in the first place. An ischemic ventricular septal defect, we would have to see some form of regional wall motion abnormality. We didn't see that, so we can also exclude this. So the correct answer in this case was actually an incidental finding.